a warm welcome from me and from Petra, who is the Elthi Membership Secretary and will be monitoring chat and questions as the webinar unfolds. My name is Chris. I have two hats in terms of this webinar. The first hat that I wear is I'm a director of Elthi, the Association for Language Teachers for Healthcare. Elthi has been around for well over 10 years now, and we provide resources and professional development opportunities for anyone who is working in this very kind of interesting, wide-ranging field. Something we do is webinars, of course, and we have a monthly webinar, of which this is one instance. If you are a member, you can go into the resources area, and there you'll find things like lesson plans, activities, access to research papers, recordings from previous webinars, and so on. So there's lots there. I'll stick the address in the chat for anyone who is not a member and would like to consider it. No pressure, of course. It's only €55 for the year. We have a conference coming up in Krakow in September. This is going to be co-organized with the Jagiellonian University there, which is one of the oldest universities in Europe. And the program is going to be announced very soon. And if you would like more details, that is the website for the Medical English Conference. So do have a look. It's going to be really cool. Program is very strong this time round. We're very fortunate to be doing it in partnership with Jagiellonian University because they also organize an English for Healthcare conference. So we put the two together. So we are able to offer kind of bigger and better, if you like. So it's going to be a great program. The presentations are just being finalized at the moment, and the program will be published next week, I think. We've got a couple of really strong plenaries as well. We've got a plenary from Dr. Andy Ward, who runs a Centre for Empathic Communication in Healthcare at Leicester University. Super interesting guy. He's also giving a webinar for Elthi very soon. And the other plenary is going to be Rachel Roberts, who, if anyone was at the IATEFL conference in Brighton last week, she gave a plenary in there on a turning point for teachers. Super interesting about how teaching is being influenced by platforms, algorithms, AI, where the value proposition for us teachers currently lies. So she's going to be the second plenary speaker. So it's going to be a great conference. So that is my Elthi hat, and Petra is our membership secretary, and Petra deals with any questions that you might have about what it is to be a member and what you get from it and how it all works. There is an email address if you want to get hold of Petra and ask her any questions, and that is very simple, admin@elthi.com. Okay, so that's my first hat. That's the Elthi hat. My second hat is the logo you can see behind me. That's SLC. And I'm the managing director and the co-founder of SLC. We started as a company in 2012 and have been working very much in English for Healthcare since 2014, when we started working with lots of European, at the time, this was pre-Brexit, European nurses and doctors who were relocating to work in hospitals across the UK, and we were supporting them in their language and communication skills, which brings me to today's webinar. Today, I'm going to be talking about social care and the language and communication needs of people who are working in social care, what those look like, whether they are being addressed, what the demand for them is, and how we can use technology to support them. So I'm going to share my screen and we will get going. So bear with me while I'm just going to do the sharing business. Okay, so here we go. All right. As we go, do feel free to stick your ideas and comments in the chat. Um, like I say, Petra will be keeping an eye on things. And if you have any specific questions, there is a Q&A as well. So do stick them in that, and then we can go through the questions at the end. If you put questions in the chat, it can get a bit lost in the conversation, depending on how the chat box is getting filled up. So do use the Q&A for specific questions. Happy to go through them at the end. Okay, so I hope you can all see my screen. If you can't, shout. If you don't shout, I'll assume that you can. So this webinar is about care workers. I'm going to focus in on the UK, but there will be a slide which shows the kind of more global picture as well. The US, Canada, Australia, and so on. So let's get going. So a little bit about us, as I mentioned, founded in 2012. We're based at the University of Sussex down here in Brighton in the UK. We've been working specifically with English for healthcare since 2014. We've always been digital, so it's always been online. We started when we were asked to write an online program for doctors who are coming from Bulgaria and the Czech Republic and Romania to come and work in private hospitals here in the UK. Great clinical skills, really knew what they were doing, but the communication was a little direct for the English patients in those private hospitals. So they wanted a program to support them in communicating in a more understated, slightly longer, round the houses British way. And since then, we've worked with nurses, social workers, pharmacists, radiographers. We've really kind of gone big into healthcare English in particular. It's a mixture of training on the one hand, and we've worked a lot with the NHS, as I mentioned, for example, and other organizations. We've done quite a lot of work with refugee doctors and nurses over the last few years, which has been an amazing space for us to work in. And we've also published digital materials as well. And we've got lots of online courses which are used by individuals who just buy them off the website. And they're also used by universities, schools, and colleges to support their teachers. So it's like a sort of digital resource, digital coursebook, comes on a teaching platform that you can use. And these are the courses that we publish. So we kind of go across healthcare as much as possible. It's a hugely varied space. There's and this really is the tip of the iceberg. We could publish thousands of hours of this stuff. This is about 850 hours of content already. We're lucky enough to work with people like Roz Wright. Roz is normally here at these webinars, but she's actually on a plane to Japan at the moment, where she's going to be working for a couple of months. And we also work with people like Professor John Skelton, who's the president of ELFI, with Virginia Allen, who many of you know through her textbooks published by Cambridge University Press. As you can see, there are a couple of care-focused courses here. We started working with care, in particular, care workers, back quite early on, about 2016, we published this course. And then we added on a social care specific focus a couple of years ago. I'm going to talk a bit more about these courses as the presentation continues, but that's where we are. The English for Care course is about 60 hours of content. The Mastering Communication is nearer kind of 15, 16 hours of study content there. If anybody's interested, happy to give you logins so you can have a look around, see if it's something that you might want to look at, etc. Okay, so let's talk about social care. So social care. So there's an army of social carers working their socks off around the country. So this is looking at the British picture. This is kind of sort of background stuff. There's an absolute army of people working with all kinds of people who need everyday support to support their daily living. A lot of the focus that we that kind of comes in the press, how we think about social care, is around the elderly, and especially the elderly who have very complex healthcare needs, physical as well as mental. But also social carers are looking after many other people outside the elderly as well. People with brain injuries, with motor neurone disease, with very severe learning difficulties, and so on. So they do incredible work. Now, recently, sort of post-pandemic, there's been a real change in and this is not just in the UK, we'll look at the global stuff in a minute, but there's been a real change in the kind of makeup of the social care workforce here in the UK. And we can see here that between 2021 and 2024, the number of overseas born social care workers in the UK increased by 160,000 to the current number of approximately 300,000. At the same time, about 70,000 Brits left the social care workforce. So the balance is changing, and this stat is a 2025 stat. But it's pretty much up to date. The current care force is around 71% British and 29% overseas, and that's a real step up from the 2019 figures that you can see there. Why are the British leaving? This is something that is not great in many ways for as a reflection on the British take on social care. And it really is a sector which is incredibly important, with the growing number of people who are in need of care, incredibly important, but incredibly undervalued. And retention has always been an issue in care for as long as I've had any contact with the sector, from decades ago to now. And in 2024, that this stat shows that very clearly. The turnover was 41% of British workers and 30% of international. There was a lot of turnover, people leaving the profession, some coming back in, but people leaving, and then some not coming back in, as we can see with the 70,000 number there. So the turnover is very high. So retention is a real problem, which means that for workforce, if you're running a care organization, you have a lot of challenges around this. The increasing number of overseas born social care workers are such an important part of the workforce now. And so with the British leaving, the care employers really need to hold on to as many overseas workers as they possibly can. It's not helped by the decision last year to stop the health and care worker visa route. This was a visa route specially opened up in the early 2020s by the Boris Johnson government to encourage people to come and work in the care sector here, recognizing the problems that existed, particularly, the pandemic really highlighted that. Huge problems with NHS hospitals, beds being blocked, as they say, by people who really need to be in the community or in a care setting. And so the visa route was introduced. Lots of people took advantage, not necessarily trained care workers either. We have a business partner in Sri Lanka who was working with Sri Lankans who wanted to come and work in the UK using this visa. Often they were accountants, teachers, social workers, some nurses. Quite a lot of nurses came over on this particular route, but a really wide range of professions who were looking to bring their kids over, put them into British schools, and make a real contribution to a sector which really needed it. However, there are a lot of exploitation, a lot of stories around about how fairly unscrupulous care employers and also recruitment agencies in some source countries were kind of using the visa to make money at the expense of those who were coming on the care route. So quite a lot of issues around that. And this was the reason stated by the government for stopping the care visa, but also, anyone who knows the UK knows that immigration is a political hot potato. And the timing of this was just after the local elections last year, when the Reform Party, who are not quite so keen on migration, won a lot of seats. So a lot of politics around this issue as well. But we can see that, so this is the situation here. So retention of those overseas care workers, super, super important, especially as there's not a new stream to replace them. And the British aren't signing up in large numbers to become social carers. Okay, globally, we can see that the UK is not alone in this. So the US, the estimate is 1 million plus new social care jobs needed by 2031. There's a massive baby boomer surge of people who are becoming older and living longer, and often in poor health. Ireland, the same. Australia, the same. Canada, the same. It really is a picture that is spread right across the English-speaking world. And if we look at the stats on overseas worker reliance, we can see that there are huge numbers of people from all over the world. Depending on the country, those working in America may not be the same people, coming from the same places as those working in the UK, but huge numbers, and a real growing dependence on overseas workers. So, which brings me to what the focus of the webinar is today, and that is the English language. We are asking people to come and work with people who have very complex healthcare needs. And the question that we look at from our particular perspective is, are they prepared linguistically? Are their communication skills the right things to be working with the care service users that they encounter every day in the jobs that they do? So on the visa that I mentioned before, the English language requirement stipulated was a B1 level. For those of you, I'm sure pretty much all of you know what a B1 is, but this is the definition of the B1, like an overview definition from the Council of Europe, who created the Common European Framework, which divided language competence into 6 levels. B1 is the 3rd level out of 6, so as in the 3rd lowest, and the kind of, the what you can do at a B1 level is described in these situations here. So can understand the main points of clear standard input on familiar matters, can deal with most situations while traveling in an area where it's spoken. So again, most kind of these familiar situations, can produce simple connected text, can describe experiences and events and so on, and briefly give reasons and explanations. The government itself has described it as a GCSE level, if we were to map it against what our kids are learning at schools when they do their French or their German or whatever they still do these days. So it's a B1 level. Okay. The tests that people are taking, there's a number of secure English language tests. The most popular one is probably IELTS, and an IELTS 4 is the standard that's required to show a B1. Now, anybody who's worked as an IELTS trainer knows that getting an IELTS 4 is not hugely demanding. IELTS, like a lot of exams, is the kind of thing that can be tutored in terms of exam prep, the kind of language you need to use, how to do the exam when you're sitting in the hall, your timing, your strategies, all that kind of stuff. And getting a 4 is not particularly high demand. So with the care visa route, a really interesting decision. They basically made it really easy for people to come in and work in the care sector in the UK, which, the huge demand for care workers. So fine in a way. But, you encourage people to come in, you say you need a B1 level of English, and then what? Okay, is it enough? Is that okay? So an employer, and I've spoken to a number of care employers over the last few years, they all assume that because B1 is in the visa requirement, it's enough. It's like a government thing, right? It's enough. So the care employers are not language experts. The care employers have never heard of the CEFR. They've never heard of a B1. You know, if I say it's like a GCSE, they go, oh, GCSE. So if my kid does GCSE French and then went to France to look after people with very complex healthcare needs, would that be enough? Would that be enough? Okay, so there are some real challenges around this. I'm going to look at it from a few different perspectives. The first one is language. So, what sort of language do carers need to know? This is not the language of traveling around and asking for a meal or booking a room or buying a train ticket or whatever, right? This is very specific stuff, and it's very has the potential to be very complex, very wide ranging. If we're looking at a wide range of both physical and mental health conditions and symptoms, and how to describe and how to understand what people are saying to you. There's all the kind of more formal language around healthcare, sort of care plans and documentation is really important, and the safeguarding and risk management. These are not, in my opinion, these are not easy things to do linguistically. When you're working, obviously communication is central to the work that a social care worker does. A social carer spends much more time with a resident in a care home than the doctor or the nurse. They're the ones who are the kind of at the coal face of healthcare provision, and that involves speaking and listening, and lots of it. However, and I've worked, I've I actually tutored a group of carers working in a couple of great big care homes up in the north of England. And they struggled. They were really struggling with the accent, with the dialect, with the idiom, with the speed at which language was being delivered. There's also this very kind of understated British thing, like when I talked about at the beginning about the doctors who we designed a course for, who were very direct in their communication. Well, we Brits are very indirect. If someone says, "How are you?" and I say, "Well, I'm doing okay," most people say, "Okay, that sounds okay." But if I say I'm doing okay, that may mean I'm really, not in a good way at all. Um, so we have all this understatement, all this indirect communication as well. So this is pretty tough if you're at a B1 level of English. And just to say as well, if you're a B1 level of English and you have no training in providing care, okay, you don't know these conversations. There's not something you've done even in your own language in your own country, which is the case with tens of thousands of people who came across on the visa route. Okay, so we've got that. Then we've got the communication skills. Now, this is right across English for healthcare, whether you're a doctor, you're a nurse, you're a psychiatrist, you're a social worker, you're a radiographer, you're a pharmacist, you need these communication skills. Anyone who's worked in OET knows it's an important part of the OET speaking test, and with good reason. As someone working in healthcare, we need to be able to show empathy. We need to be able to ask for consent. We need to be able to discuss things which are difficult, whether it be pain, discomfort, personal issues. We need to be able to check that someone's understood us, whether when we're asking them to do something. We need to be able to manage upset. We need to be able to have what may be very stressful conversations. Safeguarding would be an example of that. And we need to be able to communicate with friends and family who may ask all kinds of questions and ask you to do things which you probably aren't allowed to do. And to have the communication skills to deal with that effectively is tough, right? I mean, these are tough. It's difficult. I would find it difficult doing it in my own language, let alone in another language which I had a B1, equivalent of an IELTS 4 at. So my French is probably about a B1, and I couldn't do it, right? I could not do it at all effectively. So what do I do? What do I do, right? So Written communication has got to come in here as well. If it's not written, it didn't happen. So as a care worker, you have to be writing things down. And again, does a B1 level of English prepare you for that? Does studying for an IELTS writing test prepare you for this? Your healthcare communication, spoken but very much written, has got to be factual, clear, and comprehensible. It's got to be structured, it's got to be person-centered, and with healthcare, like in a lot of sectors, same with aviation, same with maritime, there are protocols to follow, and those protocols enable everybody to be on the same page when it comes to reporting information and understanding what is being reported. So these things are really important. But if your English isn't great, they're not easy either. So I know that I know people in the care sector, and one of the most common issues is that the overseas born social care worker will just write down something like washed Mr. Smith, changed dressing, and it's just not enough information. So the care records are very underreported. These protocols are quite interesting. I'll give you a breakdown of what they actually mean. So you can see here, I'm not expecting you to remember this, of course, but it's just an illustration of the kind of writing and the kind of detail that a social carer working with a wide range of people will need to do. And sometimes this can be quite complicated stuff. And often social carers are working in what we call domiciliary care. So they're going to the homes of the care service user and they're providing care there. And that has to be documented. And if you're not documenting it accurately, and then the next person who's providing care, because it won't just be the one person, then they are slightly in the dark. And this throws up all kinds of risk around that. So these protocols are really important. Okay, and then the other thing that we need to consider, and this is something that has come up for us and for me personally when I was teaching, like I say, are the issues of culture. So how we care for the elderly and how we think about our family in the UK may be very different to how those thoughts are had in the countries that the carers come from. So I know that in many countries that of carers that I have worked with, care homes hardly exist. The elderly are taken care of in the family, right? So having them all in a big care home in the Yorkshire countryside is a funny sort of concept. And it takes a while to kind of get inside the culture around that and how families work in one country compared to another country. So that's kind of the most obvious, I suppose, lens where we can see cultural difference come in. But there are other very important differences as well. For example, authority and hierarchy. If you are considered the sort of lowest part of a professional hierarchy, which care workers often are, it may be very difficult for them to speak up to the person above them, even a senior carer or a nurse or even higher than that, because we see authority and hierarchy in very different ways. In some countries, it's much more rigid than others. And often that's reflected in the relationships that you have within the workplace. That may be reflected in the professional culture as well. Even things like body language, looking someone in the eye, for example, may be very different from one place to another. How we see race, religion, and identity, again, this may be very different from one place to another and may bring all kinds of kind of cultural perspectives into play, which are not necessarily highlighted in an induction program, for example. So we've got lots of kind of cultural issues around family, around care, around organizational structures, around communication within that. Even simple things like being in a meeting or punctuality or so on. There are different cultural perspectives which will play out here. So we've got all these different things. We've got language, we've got communication, we've got, spoken communication, written communication, and we've got culture. And it's all kind of playing out. So what's available? What is in place to support care workers? Now, I haven't looked at America and Australia and so on. I've really kind of focused in the UK. So face-to-face classes, going to a course and learning the language. I had a look around, and there are literally like two organizations. There are a couple of further education colleges who are organizing it. This is Western College in Weston-super-Mare in the southwest of England. Interestingly, the ESOL department there is run by someone who used to work with us at SLC, but they do a skills boot camp. So ESOL for health and social care. So that's an example. There's another college up in the northwest that I found who do something similar as well. And there's an online organization which also offers it, and we do as well. But there's not much. There's really, really very, very, very little. If you compare it with training available for doctors or for nurses or for pharmacists, which is not huge either, it's still much more than is available for care workers. Textbooks, I found one textbook. I mean, that's it, one textbook. There are some other textbooks for elderly care, but elderly care is really part of what social care involves. It doesn't look at the wide range of younger people who do need care because of a physical condition, because they've been in a car accident, have been severely traumatized as a result, because they have addiction issues, and so on and so on. So the one book is there. It's written by Roz Wright, who I mentioned earlier and would normally be on the webinar. She's one of our writers as well. It's a great book, but it doesn't sell a lot. Unfortunately, it really should do. And then there's online resources, and there's the stuff that I mentioned before, the stuff that we do. So the English for Care course has been around for well over 10 years. Doesn't sell very much, if I'm speaking frankly. And Mastering Communication and Social Care, this was something that we did. It was commissioned by a social care organization operating across the southeast of England. They had some funding available to support overseas workers, commissioned a course, delivered it to 100 people, went really well, but money stopped, wasn't recommissioned. So it's all budget dependent, and there's very little out there. If anyone knows of anything that I've missed out, stick it in the chat. I would love to see it. This is not really promoting entirely, like you're saying, we're the people who do care, because there are other people who are doing it, but just not very many of them. Yes, Helen, thank you. Yeah. I mean, Express do one for elderly care, which is not bad, but it is elderly care. It doesn't cover everything else. And so, there are bits out there, but very, very few resources, unfortunately. Just shows how underserved the overseas born social care community is. So why is it so bad? Why is there so little focus on people who really need the language input? We saw how difficult it is for people working in social care. We saw how high demand the language is. The communication skills are. It's difficult. Why? So we know, and we can see from the number of British people leaving the profession, that social care is very undervalued. We have worked with quite a lot of care employers over the years, but most of the work that we have done is training the nurses who have come over as social carers to pass OET nursing so they can work as nurses. So it's not improving the social care workforce. It really is selecting nurses who have come over on the visa route, who don't have the English to get OET and so on, but supporting them to get that. So the social care, we've done very little training with carers. I mentioned that care home group I worked with. That was an exception, unfortunately. So social care is kind of undervalued. People aren't sticking the money into it. It's not seen as a kind of prestigious career like nursing or medicine. Training budgets are incredibly tight. I mean, if you look up the sort of headlines on social care provision, everyone's complaining there's no money. The recent decisions by the UK government to raise employers' national insurance, to raise minimum wage, in themselves, not bad things, but led to more training cuts across social care. The logistics of getting carers into the classroom, almost impossible. Everyone's working very long, very intensive shifts. Those people who are working in the homes of the care service users, they're all over the place. So in terms of actually trying to get people into a learning space, into a classroom, whether it be physical classroom or online classroom at the same time, once, twice a week, almost impossible, because the lives are so full with either work, and then often, especially on the people coming over on the visa route, a lot of childcare responsibilities as well. Something that I came across when I was working with the care homes in Yorkshire was public transport. Just buses, few and far between. So all kinds of logistical issues. And then we have things like getting hold of a decent laptop, getting decent internet. Not easy either. I mean, it's something that we think less about these days as broadband speeds have become much better, but there still is a certain amount of digital inequity which cuts across income lines. And then books and online resources on their own aren't really considered enough. Like a care employer is not going to buy 50 copies of Roz's book, for example, and give them out and say, there you go, because they understandably feel that more support is needed, and those resources need teaching and mentoring and so on. So we've got all these things. So we've got a combination of how social care is seen, and I don't think just in the UK, I think internationally as well. And then the money that's available, the logistics, the digital stuff, and what good training looks like. So some real problems here. So there's no real support linguistically or from a communication skills perspective for overseas carers. And what does this mean? What does it? So what do you end up doing? So I remember working with the people I mentioned before, and they're just making it up as they go along. They're helping each other, but they're not a great resource for each other either. So you develop these kind of heuristics where you're just kind of you're responding in a similar way to a similar situation in a way that you think is going to be okay. You develop these kind of strategies for getting by. The fact there's no support means there's no or very little CPD to support people. There's no feedback from a language expert to say, look, hang on, don't do it like this, do it like that. Why don't you do this? Why don't you use this kind of phrasing instead of that kind of phrasing, that kind of thing? So it's just not really in place for the vast majority of social care workers. As a result, language really holds people back. And we've seen that in not just social care, but in many other sectors as well, where language really holds you back. And I've been working with a group of Ukrainian doctors recently, and they're all working as social carers or as GP receptionists because language is holding them back. And that is very much the case with social carers too. Have come across from a wide range of different countries and are kind of stuck because their language is not developing, their confidence is not developing, and they're not feeling able to even move up to a senior carer level. There are communication breakdowns and cultural misunderstandings happening all the time, unfortunately, and there is a negative impact on care. I mean, the social carers that I've worked with personally are amazing people, kind and thoughtful and really wanting to make a difference. But being held back because they can't really understand what people are saying to them. They can't communicate in a way that they want to be able to communicate, and that just impacts on the effectiveness of the care that's been delivered. And if you go to a care home or a nursing home here in the UK, so many people come from so many different countries, and that without the support is problematic on the level of care that we're just capable of providing. People who need it, people with complex conditions, comorbidities, and so on. So this is pretty tough So what do we do? What do we do? Um, So, we've been struggling with this. Like I said, that first English for Care course came out back in 2016, and hasn't been used by nearly as many people as we thought. And it's a really good course. It was written by Virginia Allen, who really knows this stuff, right? It's a really good course. But when we spoke to care home groups, when we were doing the work with nurses, they were saying, yeah, but the care workers, we're not going to buy it in for them because the training budget's not there. We think that if we buy it in for them, they might leave in a year's time anyway, and so it's not really worth it, and so on. So it's really tough. So what are we doing? Yes, Helen, absolutely. It really is a pity. But we still think there's the real problem here. There's a real problem, and I think it's a problem which needs solving. So we've been kind of figuring out where, as technology has been moving so quickly in the last couple of years, been trying to figure out what we can do to change the situation. So I'm just going to talk a little bit about the project that we've been working on, and it'd be great to get any thoughts and feedback from you. Um, so we started off with, okay, we're online education specialists. We always have been. So that was from the very beginning in 2014 2012 when we started. So we started as online education, and we're still online education. We do teaching, but it's online. We love the digital thing because we think it just gives reach and it just expands what you can do. And so when we were thinking about this, we started off with the online study resources that we created. And that was like a sort of starting point, but we've had to, clearly it's not enough because people aren't buying it. The care homes aren't using these things to support their workers. So it's not enough. So we're looking at how to build and what we do. And it's only really now with the advance of AI in particular that we've been able to think about this in a different way. So I'm just going to sort of take you through. So we're starting off with the online education. You can see the first screen here. This is just a mobile phone screenshot. These are just some simple videos that we have in our courses. And then what we've done is that we've trained an AI to provide feedback and learning recommendations to care workers who are using the content. So there's no teacher, which, I mean, AI does a pretty good job. It's still not the same as a teacher, but it does do a pretty good job. And I will show you what it's able to do. If we called, if the care employers would employ teachers, so much the better. But it's just not going to. It's just not going to, or in very small numbers. So we need to be able to provide something alternative. So we've trained an AI on all the content that we have. And not only did we train the AI on the content that we had, we threw in the Care Quality Commission's guidelines and the Care Certificate syllabus and learning content around that. That's to add safety and guardrails around the kind of conversations, the kind of interactions that care workers can have with the content. So we've taken this AI and we've trained it on the stuff that we have published, plus. Okay, we've thrown in gamification, so badges and sort of leveling up in terms of taking your care-focused English to a more intermediate and advanced level. And we made it mobile phone first as well because of the digital access. Everyone's got a smartphone, and if you get a half decent connection, you can do this stuff. These are the sort of changes that we made to really build on the online content that we have already developed. There's a couple of screenshots here. I just took these this morning. This is just some of the educational input, and then this is a scenario practice. And I'll show a bit more detail on this. The whole thing is based on a cyclical learning thing. So you start with the learning input, which would be these videos here, for example, and some text-based stuff. You then do scenario role play practice. So you're doing the learning, theoretically, you're doing the learning, and then you're entering a scenario with a care service user, which has a specific set of instructions around it. So you're working on mobility, you're working on personal care, you're working on mental health, whatever it happens to be. So there are scenarios. You engage with a scenario, and that's this one here. So and I'll show you this in a minute. so the learner input, the learner puts in their side of the conversation, and then the AI will score the feedback, and will not only score it, it will tell you what you can do better. And then hopefully you reflect a little bit, and then you think, okay, let's try it again, but using this. Okay. And then so you repeat it, and then you go around again. And it's an iterative process. And with the other thing about the AI, it's a different conversation every time. So it's not a predictable conversation necessarily. So it will respond to what you say as a carer as well. So if you're providing brilliant empathic care, you'll get one set of responses, and if you're providing kind of negligent, dangerous care, you'll get a very different set of responses on the other as well. And then that will feed into your scores and the recommendation. So this is what you would get as a learner. So as a social care worker, you would get a range of different feedback. So I'll show you a few screens from this. So this is something that this is me. I did a couple of different sample ones. I did a good one and a not so good one. This is the good one. So I got 9 out of 10. Not perfect. I've still got a little bit of work to do, unfortunately, on the clarity of what I was saying and my level of empathy. So I'm not quite perfect. Did pretty good on the other stuff. And there's an overall kind of like strengths acknowledgement there, and a summary of what I did in the role play there. I'll contrast that with my other one where I was not a great carer, I have to say, and was a little bit unsafe in my practice, and I got 4 out of 10. And you can see it breaks it down here into the different categories. So we're scoring it by different categories: empathy, active listening, clarity, patience, and professionalism. And that's that's kind of the AI learning from the content that we fed it. It highlights my strengths here, which I wasn't disastrous, but I wasn't great. And we can see here, learner demonstrated a basic ability to follow a mobility routine, but failed significantly on safety by pressuring the patient to violate post-surgical hip restrictions. I was encouraging the patient to put his shoes on himself rather than me support him, and that wasn't a great thing to have done. This is the task achievement. Did I achieve the tasks? This is so we can see here that 4 were achieved, but 2 weren't. Safety and escalations, -4 here. This was because I said, come on, Mr. D, I think you can do this for yourself. No, just try. And that was really not a great way of speaking to the person in this particular scenario. And then also there's an escalation issue here. So we're getting feedback on safety and escalation, and then we're getting language feedback as well. So feedback on the spelling, and I'm typing stuff in, on the grammar that I used, on the phrasing that I used. So the feedback is pretty detailed. So it covers a lot of different areas. And then the other thing that I get as a learner is I get the feedback, and that's great. And I can read through that and think, okay, fine. And then I get areas of improvement. Now we haven't put, a long list because it gets a bit confusing. We put like a couple of real focus points, so you can then try these out in the next time you do the scenario. So there's a couple of areas of improvement, and then recommendations for next time. So this is the kind of feedback that you get. So before I go to the questions, let me just show you the thing in practice so you can see what it looks like. This will be on a PC, so it's on my laptop screen here rather than on a phone, so the display is slightly different. It is optimized for the mobile phone, so it is better on a phone, but I can show you what it is. So I'm just going to stop sharing there. I'm then going to bring up the web page that I have pre-prepared, and I'm going to share this with you so you can have a quick look at this, just a couple of minutes, and then you can see what we're doing here. So this is my dashboard. There are different modules, and there are different badges that I can get. I've only won 2 badges so far, a First Steps badge and a Star Performer badge. This is not on the market yet. We've just finished testing it with about 50 different carers, and we're doing a few tweaks before launching it properly in May. If we look at the different modules, we've got 8 different modules at the moment. And these all cover kind of core communication scenarios with service care users. So from welcoming a service user to talking about food and drink, to talking about personal care and so on, talking about mobility. So these are all important things. If I look at the scenarios, we can see that these are the different scenarios at the moment. We're going to be building these out, so there'll be a few more of them. They've been categorized by kind of language and also communicative stress, so difficulty. So if I go to beginner, we can see we have these ones here, intermediate, and just a couple of advanced at the moment. And if I want to do one, so if I go to mobility, for example, which is the example I just showed you with the scored feedback, I click on that. Here we get a bit of input. This is from Jo, our academic manager. She will talk you through the kind of scenarios.
And welcome.
So she is actually an AI version of Jo, but she's just come back from maternity leave, so we're going to create proper versions of Jo. So this is her giving. That's not a great picture, is it?
In this unit, you're going to practice how to talk about mobility with service users.
Okay, so she goes to the language. Here are a couple of videos which show role plays. So you might watch the videos. This is the one that I was doing. But
hello, Mr. Dawkins. How is your hip today?
A lot better, thank you. I still have quite a bit of pain when I...
So this is a kind of example of a conversation with a patient who's had a hip operation and having problems moving, and the carer who is supporting him. Key language phrases, model dialogues. So you can read through that. So what we would expect someone to do is to watch the videos, have a look at the key phrases, make sure they understood, look at the different model dialogues, and then move to a scenario-based practice. So if I go to Mr. Dawkins, these are the instructions. So this is Jo, our teacher here, and Jo gives you the instructions. You know, you're assisting Mr. Dawkins, recovering from hip replacement. So read through the scenario, and these are the learning objectives. So you would read that, and you say, "Okay, good, understand it. Let's do it." So then let's
hello.
Go. And there's Mr. Dawkins. Hello. Now, I'm going to be typing in, so I'm not speaking yet because the voice recognition software is not very good at working with B1 level learners from a very wide range of countries. It makes all kinds of mistakes. It's going to change, and then we'll upgrade it. But at the moment, the speech to voice stuff is not ready for this yet, but it's not far away. But so at the moment, the Mr. Dawkins will speak, and I will write. So I will say, hello, Mr. Dawkins. How is your hip today? Ooh. And then the software will have a little think, and then Mr. Dawkins.
It's still sore, but better than yesterday, though I'm not about to dance a jig just yet. I'd like to get up for a wash, if you're free to help.
Okay, so the AI has a slight sense of humor. Well, I'm not about to dance a jig, but he'd like to get up a watch to have a wash. Okay, so I'm free to so of course I'll help. Shall we get your walking frame? Okay, let's need to spell it correctly. So let's see what Mr. Dawkins says.
Yes, please. I can't manage without it. And I'll need you to remind me how to sit up properly. I keep forgetting the leg rules.
Okay, so now I've got a bit of a challenge. I need to ask it and remind him how to sit up properly. So I'm going to say, okay, try putting your hands either side of you and flat on the bed, right? On the bed. Then push, I can't spell today, push up a little. And then I say, can you try that? So I'm being a nice carer today. Can you try that? And let's see what Mr. Dawkins says.
Right. Hands flat. Push up. Yes, that's better. Legs still apart, like the physio said. I'll swing them over slowly. Don't want to twist.
Okay. Okay, so we'll stop there, right? You get there, then complete the chat, get the score. That takes a little bit of time, up to 5 minutes to get my score and the feedback. So if I just go back to here, and I can go back to, this is my admin area, and I can look me, here's me, and oh, this is the one I just did, only 3
Hello?
messages. But it's not quite, oh yes, it is already ready. Okay, let's see how we scored on those 3 messages.
Hello?
8 out of 10. So it was only 3 messages, so the AI doesn't have a lot to go on. But it says, learner was professional and clear, followed safety protocols, and so on and so on. The more detailed ones is if I come to the, go back to me here, and I go to the one that I did, which scored 4. So talking about mobility here. If I
Hello?
click on that, here are the screenshots that I showed before. So that's all the feedback that I'm getting as well. And as an admin, I can see that as well. And then I can see the actual interactions. So I can read through the interaction and see what happened there as well. So I'll stop share. I think that's kind of a very brief overview of how this works. So you can see that the AI is producing a tailored conversation, a tailored scenario-based conversation, and it's giving scored feedback, and it's giving a ton of recommendations as well. So lots of for me to think about. And as a teacher or an administrator, I'm also getting a sense of what my workforce are doing, where they need improvements, what areas are strong at, and so on. So there's quite a lot of information here. So I'm going to stop the sharing there. I will just, I think I'll just bring up the presentation. And the next slide was just any questions. So you can see how this works here. So you can see here that this is what the thing. So we're hoping, I'd be interested to get your thoughts. We're hoping that this is going to provide some sort of training solution for people who really need language practice and feedback based on the work that they're doing, the interactions they're having with service users in all kinds of different situations, and that will help them improve by getting the feedback. We're trying to put gamification in there to make the motivation, so people will come back and they will see if they can kind of go up in terms of level, or they can do a daily run on things and so on. But that is it. So social care. It's such an important area. It really bugs me. That there are so many people working in the UK and globally doing incredibly important work, which is also really undervalued, and where they're not getting the input on language and communication skills that would make a real difference to them and a real difference to the people that they're working with. So we're trying to figure out how to resolve this problem, and this is what we're coming up with at the moment. Obviously, I think it has to be technological, because that gives us reach and affordability as well. And it has to be something that can be got into all these different areas where people are working, whether it be supported living or home-based care or care homes and so on. So it has to be something along those lines. Anyway, so that is it. Does anybody have any questions at all? Well, that is a resounding no. Okay. Well, look, here are my contact details. If anybody would like to get more information about the work that we're doing, please do get in touch. And if anybody would like to ask any questions or have access to some of the materials and so on, again, do get in touch. My contact details are there. And if you have any thoughts that you would like to share away from the webinar, again, send them across. I'd be really interested to hear what you think about this. So, so thank you. Okay, so thank you for being here. Thank you for sticking with me while I rambled on for the last hour. Time, I guess, is very much up. And so I will leave you to the rest of your days and say goodbye, 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 goodbye. Okay. All right. Take care, everybody. Bye.